Welcome to Seeing the Full Picture, a podcast about systems thinking for health systems. This is a special podcast series from the Alliance for Health Policy and Systems Research. It was developed with the George Institute for Global Health. Systems thinking is described as a way of seeing, an approach towards problem solving that considers problems in the context of the wider system and places an emphasis on the interdependencies across system components instead of focusing on individual components on their own. It is applied widely in different industries and holds significant value for strengthening health systems. There are 5 episodes in the series, each approximately 45 minutes. Topics include foundations in systems thinking for health system strengthening, background to systems thinking more generally, examples of systems thinking in health, lower middle income country experiences, and political and policy challenges. We hope this series will inspire you to consider the relevance of systems thinking approaches in your work, and that listeners will go on to be part of a new generation of practitioners and researchers advocating for the importance of systems thinking in strengthening health systems globally.
I'm Devaki Nambiar, and I'm a health policy and systems researcher working at the George Institute based out of Delhi in India. My training is as a social scientist, and given my background, which includes training in anthropology and mixed methods research, and some work on HIV and AIDS and stigma and discrimination, the intersection of society and health systems has always been of interest to me. And about a decade and a half ago, as some of the literature on systems thinking and health policy and systems research was coming out, my interest was piqued, but I wasn't sure if I was part of that tribe. So I became very interested in trying to explore this a little bit more. And this podcast is, I suppose, in a way, Stephen and my journey through trying to understand this a little bit for ourselves and with people who've done more thinking in this space. And I dare say we've been feeling more and more connected to this idea. But my hope here, as with others, is to start to open up the box of what systems thinking is, where it comes from, and what possibilities it holds for people like us who are interested in making a difference in health systems in our contexts.
Hi, I'm Steve Jan. I'm a health economist and I'm also a health systems researcher. And much of my research over the years has really been about the evaluation of programs and understanding why and whether programs work and whether they're cost effective and how they can be implemented. And for a number of years now, I've been a little bit sort of dissatisfied with the tools that I've had been able to use based on my training. And partly that's because what I feel happens in the healthcare system isn't fully reflected in the things that we try to measure and try to sort of evaluate in our studies. And the idea of systems thinking and using health systems research to try to unpack some of the broader implications of what we're trying to achieve in health systems, I think is a really appealing way of developing the research that I do in my field. The one thing I've learned through this whole podcast series has been the wide applicability of systems thinking, the fact that it can be applied to different ways of doing program evaluation. It can be applied to clinical practice, so even in the most extreme settings, as we heard from some of the emergency doctors that we interviewed, and also in policy making, in government decision making, and in setting new laws and regulation.
Thank you for listening. Make sure you subscribe to Seeing the Full Picture so that you don't miss an episode. You can find us on Apple Podcasts, Spotify, or wherever you get your podcasts.